Hi, this is Gina McCarthy. I'm the president and CEO of NRDC, an advocacy organization. Howard is going to introduce himself in a moment. But let's just say how excited we are about the 2020 Lancet report coming out and how grateful we are for the authors to be able to take a close look at what's happening in the United States and how the issues of climate change and health are so intimately connected, and how I think we both know that the challenge of climate is really one of the biggest public health issues that we face. And that in the US today, it's so confusing to figure out how we align all of our strategies and really address the issue of COVID-19 first and foremost, and then look for a climate strategy that really grows jobs and shore up our economy and can provide us all a healthy future. So that's what Howard and I are here to talk about. Howard, take it away. I'd love you to introduce yourself, and then maybe we can have a little bit of a chat.
Sure, Gina, thanks so much. What a privilege it is to join you yet again. I'm Dr. Howard Koh. I'm a professor at the Harvard Chan School of Public Health and the Harvard Kennedy School, and I'm the former U.S. Assistant Secretary for Health in the Obama administration and the former Massachusetts Commissioner of Public Health. And first, Gina, I want to thank you for your leadership and your friendship and your commitment. You've inspired so many of us around the country and around the world on issues of climate change and health. Let me thank you and all the leaders of the Lancet Countdown, because what this wonderful group is doing is tracking progress on health and climate change, putting forward a special briefing on impacts in the US, and bringing together over 70 institutions and organizations, including the American Public Health Association and many others. And these issues of health and climate change are very important to me as a physician and former assistant secretary and former commissioner. Among many other things, right now, the COVID pandemic is consuming all of us, but it's also forced every person on this planet to take a broader view on what is health, not just for ourselves, but for our families and communities and the people we care about and love. And in that context, the Lancet Countdown highlights that COVID and climate change represent converging crises, because both crises impact literally every aspect of human life. We all know that climate change affects the food we eat, the air we breathe, the water we drink. And people used to think that climate change was something that would occur in the future, but we now all understand, and the Lancet Countdown report reaffirms that climate change is disrupting lives and livelihoods right now. So what I'm very appreciative to you, Gina, to the leaders of the Lancet Countdown, is stressing that we have to tackle these two crises together. We don't have the luxury of choosing one versus another. We have to do this as a society and as a global community. And I think that's what the opportunity is for all of us. And as a physician, I'm very grateful for the many health professionals and clinicians who are stepping forward to say publicly, this is a crisis for the health community, and we health professionals have got to join the environmental leaders and so many others through society to make a difference in this critical area.
Well, Howard, I know that, just to add, is that, you know, I think both you and I know that it's taken a long time for the general public to understand the connections between health, the work that we do, and systemic racism. And then add on to that, trying to make the direct connection between the systemic racism and climate. And I think you and I have known for a long time that there is a direct connection with the kind of systemic racism that we see in this country, and frankly in others, that's showing up in the numbers in the Lancet report. You know, we recently did a report at NRDC to look at a parish in Louisiana, to look at the impacts of Hurricane Laura on that parish. And you can very easily see that these are communities that live in the fence line and front line of lots of chemical industries. And you can see how climate added on to the public health burden of living in that area and being exposed to air pollution hammered them more than any other. You know, one of the things that I'd love to get your sense of, but I was reading during the COVID-19 crisis, the frontline headline news that Black Americans were dying at 2 to 3 times the rate of their white counterparts when exposed to COVID-19. And that made front page news. And you and I know we could have predicted this, right? Isn't this something we've always seen about the communities that have been left behind?
Yeah, Gina, thank you for emphasizing that theme. And Gina, you've been a champion for environmental justice for decades. But as you're pointing out, the impact of COVID on communities of color is not unexpected, but still completely unacceptable. And we're seeing the same themes with climate change too, for all the reasons that everyone understands so well, that climate change impacts everybody, but particularly vulnerable populations and particularly communities of color. So these converging crises are impacting health equity in substantive ways. And so we got to address, again, all these crises together. Let me say a little bit more, Gina, about how health professionals can make very concrete contributions in this time of need. I think if every clinician and physician and health professional can say to patients and others, this is threatening our health right now, it's not a future threat. All you have to do is turn on the TV to see news about floods and extreme weather events and other health crises related to climate change. If we can help advise, for example, the elderly person who's vulnerable to heat exhaustion and help that person be better prepared. If we can help a child wrestling with asthma about how to be better prepared for exacerbation that could be linked to climate change, and communicate directly to the people we are serving that this is all linked to something that we can address right now if we work together, that will be very, very powerful. And then, Gina, I hope that health professionals can join environmental leaders like you and business leaders and our elected officials at the city, state, and federal level to make this our highest priority going forward. Gina, at this point, maybe I can ask you, because you have been revered really as such an outstanding leader for the EPA in the past. Do you want to comment about the future priorities for an EPA and maybe the future priorities for a Biden administration to come?
Yeah, I'm happy to, Howard. But you know, I want everybody to know that one of the reasons why I spent some time at the Harvard School of Public Health is you. I mean, the work that we did together made me realize even more strongly than the time I spent on the environment about the direct connection between climate and health and the way in which health professionals really need to get into the environmental world and how we could be helpful in making climate such a real and immediate and relevant and actionable step to take. So I know that I'll probably complain a lot about rollbacks from the Trump administration. I'm so over that. I am so optimistic now. It is really a very hopeful time. And when I'm asked what do you think EPA should do now? I tell them the number one thing is to get an EPA administrator who is the Anthony Fauci of EPA. I need human beings who focus on science. We have to be back focusing on evidence-based decisions in science, like the information that the Lancet report brings to our eyes, so that we can make sure we're doing the right thing for people, not advantaging polluters. And I have to say that I'm really excited about the Biden-Harris administration. You know, I'm kind of over the moon because they unified the Democratic Party in a way that really, I think, is going to be reflective of the ways in which we can bring our country back together again. You know, we have to have solutions for moving forward that don't just address COVID-19 by getting people food to eat again, getting them the wherewithal to have a job and grow our economy. But there's so many ways in which this administration can make good on what was the most aggressive campaign promise that any president has ever made on climate change. And that was Joe Biden's plan. I mean, he basically said we're going to have clean energy by 2035. Yahoo. We're going to be aggressive out of the gate on setting standards on power plants and on cars and trucks. We're going to look to meet our goal in 2050. We're going to rejoin the Paris Agreement. You could go on and on and on and on. So now we have to deliver it, right? We have our marching orders moving forward. And I have to say, last but not least, Howard, before we talk a little bit more about HHS and others, is that we have Kamala Harris as our vice president. I have been hearing that glass breaking over our heads ever since. I mean, really, what is this going to send as a signal to girls everywhere about what they can be when they grow up, when you have a woman of color taking a position as the vice president? There's a lot to be hopeful for, and frankly, a lot to celebrate.
Well, Gina, thank you for your passion, which is always evident whenever you say anything about anything. And so it's great to hope for the future. And I see a bright future like you. I know that when you and I were working together at HHS, I oversaw a tiny office trying to coordinate environmental health issues for HHS. And then we had the pleasure of contributing to the government-wide efforts for the President's Climate Action Plan that was unveiled in 2013. But I think with this Lancet Countdown report, with renewed awareness and energy in the future, we need all of HHS working together as one agency to make this a priority, together with addressing COVID-19. We need all of federal government, especially and including the EPA, to help coordinate these efforts. And I'm so glad you mentioned the Paris Accords, because you were so instrumental in that, Gina. Another example of your great leadership. We got to do this as a global community, and we have to address the COVID crisis and future COVID vaccination efforts as a global community as well. So these are crises that are converging that we have to address together. That's the overriding message of the Lancet Countdown that I so appreciated. And Gina, it's going to be great to work with you and so many others, I hope, to make this all go forward.
Well, Howard, the last thing I want to point out is that I learned a little bit from you when you were at HHS, because we had worked together back when you were commissioner, when I was working in the environmental agency in Massachusetts and did some work together. Is that, you know, the one thing that I learned was we did some work together on both lead, trying to get lead out, and because it's just a tremendous neurotoxin that impacts kids primarily. And then the second issue is radon. And what you taught me was on the work we did on radon together was how much the federal government in and of itself has the authority on how it behaves, how it spends its money, how it invests in the future. And it gives me hope right now, because we developed across the entire administration plan on how to reduce radon exposure. And we had the military talking about military housing. We had HUD talking about the ways in which they could make a change so that multifamily dwellings could be assured to be radon free when people came in and rented a place, right? So we talked about all those things. And that's the key, is that people always go, well, you may not have the Senate, blah, 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 blah. No, but we have the federal purse. We have ways in which we can influence this. And I'm excited about where we are today. And I'm excited to make the connections and let people know that we're going to have great people like you, Howard, in positions that will make a difference, that have always understood these connections your whole life and has been doing nothing but try to make everybody understand that government's there to work for them, because you've been doing it for so many years. And I love seeing you on TV. I think it's the coolest thing ever. Get a series or something.
I'm just trying to catch up with you, Gina, you know. And Gina, you're the one who taught me that the only way to solve these global crises is to bring everybody together across disciplines. And I often say that we health professionals spend too much time talking to only other health professionals. We got to reach out to leaders in environmental protection and housing and transportation and education, faith-based organizations. I like to point out that health is much more than what happens to you in a doctor's office.
Yeah.
Health starts where people live, labor, learn, play, and pray. I made that up, by the way. And that's the only way we can address these challenges for the future. So, Gina, to have global leaders like you inspiring us and showing us the way is very, very encouraging for all of us. So thank you.
Well, it is a moment in time, and thank you, LANCET, for bringing some clarity about the connection between health and climate and systemic racism. I know that clean energy can buy us a wonderfully healthy future. It can bring jobs to people's tables, and it's going to save the money in their pocketbooks. And I expect that a Biden-Harris team will do wonders to bring us all together and to make sure that we can have the kind of health protections that our country promises to us. And hopefully we'll keep delivering them together. And thanks so much for joining today. And thanks for all of the folks who pulled together the US report. Kudos to them for reminding us of just where we need to go at a time when I think we have a path to get there. Thanks, Howard.
Well, thank you, Gina.
You're the best.
You too. Thank you.